Hi, I'm Amy with Rescue Natural Supplements, and joining me today is Dr. Melissa Josselson. She's our naturopathic doctor who serves on our medical advisory board. And today we are going to be talking about women's heart health, which is really important since it is American Heart Month. So I think the two questions that we definitely want to start with today, because they're really important, have to do with diet and exercise. So let's talk about diet first. People talk about eating a balanced diet. What does that really mean?
So to me, what I recommend is really focusing on eating clean, whole foods that basically prevent disease rather than emphasize foods that harm you and can increase your risk of disease. So balanced meals are important, having some protein and carbohydrates and fat, but I think most importantly for staying healthy long term is you want to emphasize a largely plant-based diet. And then again, minimizing foods like trans fats and refined sugar and refined carbohydrates that we know will be disease promoting.
So are we talking about the Mediterranean diet essentially?
Yes, largely that is what research is based on as one of the healthiest diets for reducing your risk of heart disease and other diseases, down the road. So if you can follow that plan or those guidelines, then that is an excellent diet to follow.
Good, that's good to know. So we said we were going to talk about exercise next, and that's another one that I think can be confusing because we know we're supposed to get moderate exercise. What does that really mean?
Right. So, moderate exercise, you do want to incorporate a combination of aerobic or cardiovascular exercise as well as some resistance or strength training because they do have different benefits, but they all have a host of benefits as a whole. And so, if you look at the American Heart Association's guideline, they recommend 150 minutes of moderate exercise per week. So that's about 30 minutes of exercise 5 days a week. 5 times a week. And so anything to just, again, make sure that your heart rate is getting up for those 30 minutes, would be classified as moderate exercise.
So when you're exercising, I know, you can get a little dehydrated, and of course exercise isn't the only thing that can cause dehydration. Dehydration can be bad for your heart though, can it?
It can. So surprisingly, it can have pretty significant impacts. So when you become dehydrated, your heart has to work harder. So essentially put strain on the heart. And also your blood can thicken, and essentially it could be, as harmful almost as smoking or smoking a cigarette at times that you're dehydrated. So we know that it does have a negative impact on the body and your heart. So you do want to make sure you're really getting in that water each day.
Yeah, definitely. That makes me want to drink more water for sure. Yes. So exercise is definitely, good for stress management. And that's another thing that when we think about, stress and heart, there's some implications there. What can you tell us?
There are. So, there's a lot of chemicals and hormones that are released in response to stress, and ultimately, chronic stress will promote inflammation in the body, and your blood pressure can rise and your blood sugar can rise, and these are all risk factors for heart disease. So the long-term effects of chronic stress will increase your risk of heart disease.
That's pretty scary. And sleep, I know, when you're stressed, you're not sleeping well, and that's not good for your heart either. So what's some advice that you can give to people?
Yes, so if you're not sleeping, you need to sleep for sure, and you really need to get 7 to 9 hours of good quality uninterrupted sleep per night. Sleeping fewer than 6 hours per night, we do know based on research, increases our risk of heart disease as well as other chronic diseases later in life. So you really do want to make sure that you're getting enough good quality sleep each and every night.
And finally, I want to talk a little bit about some of the symptoms that women have with heart disease that men might experience a little bit differently. Can you tell us about some of those?
Sure. So when we think about heart attacks, men especially, tend to get that crushing chest pain or maybe that, pain radiating down the arm and so forth. But women can really present a little bit more atypically. So they can almost feel like they have the flu. They're just very, very tired. They might have nausea and vomiting. They might have jaw pain or back pain, just something that's, not right, but they might not immediately associate with a heart attack. So if, symptoms are not resolving and not going away, it's always better to seek care.
Great. Well, this is really helpful. Thank you for joining us today. We're thankful to really learn about all these different tips that women can take advantage of to make their hearts healthier. And if you'd like to check out any products to make your hearts healthier, you can go to myrescueproducts.com. Thanks for watching.